The broadcast is now starting. All attendees are in listen-only mode.
Hello and welcome. This is Lucinda Nord with Indiana Association of United Ways, or IaUW, welcoming you to this third in our series of mini webinars about healthcare. In this session, we will talk about the IaUW Navigator grant, and this session is actually targeted for our members and stakeholders to learn a little bit more about the Navigator grant. So in this session, we will talk a little bit about what is a Navigator, the background on the grant, our description of our subcontractors, and share, as we do with each of the sessions, a review of the key ideas. So let's start with a little bit of the background. Last August, the Centers for Medicare and Medicaid Services, also called CMS, announced a $424,000 grant through United Way Worldwide for Indiana. And initially, that grant included a primary role for Indiana 211 Partnership in its data management, its ability to provide pre-screening and referrals, and actually to hire navigators itself to facilitate those enrollment. However, post the award announcement, CMS required a redesign of the project where Indiana 211 is actually no longer a part of the Navigator grant as a part of the United Way Worldwide IaUW award. Rather, the 211 work that you may hear described in some of these webinars is completely privately funded, and the CMS Navigator grant is being used for other work that we'll describe in this session. How it came about is that we were working with key healthcare stakeholders such as the Indiana Hospital Association, the Indiana Primary Healthcare Association, Covering Kids and Families, and many other healthcare stakeholders. And we learned that there was a real demand for both the 211 as a central hub, but also for navigators in special areas of the state. And the healthcare stakeholders were really looking toward the future, thinking that healthcare enrollment is not just a 2014 issue, but a multi-year project. So with that in mind, we redesigned our program so that we would be building capacity for the long term as we meet the current needs in those underserved areas. So what does a navigator do? By the CMS definition, and which is required for all CMS-funded projects, a navigator must actually do all 5 functions of a navigator. So most people are familiar with the function of helping people enroll in different health plans, but there are actually 5 separate functions. So I'll just highlight those. That first, the navigator must become an expert in what the different types of qualified health plans, or QHPs, are. Secondly, and perhaps most important from a CMS funding perspective, is that the CMS-funded navigator must provide fair and impartial information about enrollment in the health plans, tax credits, and cost-sharing information. So they are not permitted to direct consumers to a particular plan, but instead able to provide information about all of the options and then allow the consumer to select a plan. The navigator is to facilitate enrollment, which may mean helping them walk through the process, helping them make those find information so that the consumer can make best choices, and then actually to provide referrals to other relevant programs, for example, the Health Insurance Consumer Assistance Program, because there is a sincere concern about consumer protection in this project. And then lastly, to make sure that all navigator services are provided in a culturally and linguistically appropriate manner by what we call class standards. You'll sometimes hear that referred to as class standards. All navigators in Indiana have to be certified, but those navigators that are funded by CMS must comply with very specific and stringent privacy and security standards, including how to handle that personally identifiable information, They must abide by certain conflict of interest provisions, which may not apply to other types of Indiana navigators which are not CMS funded. They must comply with certain consent provisions. So for example, they can't just do work on behalf of the consumer without that consumer's knowledge and consent. So CMS funded navigators have to complete 2 sets of training and certification, one by the federal government, one by the Indiana Department of Insurance, to comply with Indiana law and rules. In addition, navigators in Indiana must complete a background check, and there are some fees associated with becoming an Indiana navigator. So in Indiana, there are actually 2 types of navigators, but they all carry that designation of Indiana navigator. So the navigator services in Indiana include the CMS, the federally funded navigators, Indiana navigators, federally funded and state-funded assisters or privately funded assisters, and then other already licensed individuals such as insurance brokers. Indiana law does require Indiana navigators or some sort of licensing, for anyone who's going to be doing navigator work. Where might the navigators work? They might work out of hospitals or health centers, community-based organizations, faith-based organizations, and the like. And as of early January, the Indiana Department of Insurance, or IaUW, reported that there were nearly 700 individual certified navigators throughout the state and over 50 applicant organizations where those navigators are employed or volunteer. It's important to note that there were lots of organizations that formerly, before 2014, provided some type of enrollment assistance for individuals wanting to enroll in Medicaid or into some sort of health plan. All of those individuals beginning in 2014 have to have that Indiana Navigator status. So for the IaUW Navigator Grant, we selected 4 organizations. It was actually done by a committee. We had many more applicants and selected these 4 organizations: the Community Action of Southern Indiana, which is just north of Louisville in the Clark, Floyd, and Jefferson and Harrison and Washington County areas. Community Health and Wellness, which historically has been a health center, and that's based in Bedford but serves many counties. Meridian Health Services, is actually based in Muncie, but for this project will serve the eastern part of the state. And then Swerka and More, which is an area agency on aging based in Evansville, will serve the southwestern part of our state. So if there are questions about the Navigator organizations or services, we do have a Navigator coordinator, and her name is Julie Cagle, and you can see her contact information there, or I, Lucinda Nord, can also serve as a contact. We recognize that there might be additional media questions or external communications, and we just want to make sure that all those questions get to me, Lucinda. And then just as a note, we highlight, because there is such a connection with the information piece managed by Indiana 211, we provide to you in this website the ability to call 211 to learn about navigators, or to visit the healthcare.in211.org website, where you can learn about the outreach and enrollment events where navigators will be present. So what are the key ideas to remember about the IaUW Navigator Grant? First, what a navigator is. That navigators provide impartial information and facilitate enrollment into different health insurance programs or health insurance plans. IaUW is subcontracting with 4 organizations to provide those services, primarily in underserved areas of the state and with an eye of building capacity toward the future. And then lastly, Indiana Association of United Way Navigators, the subcontractors that we hire will meet both the federal and the state requirements as navigators, including criminal background checks, training, certification, and a number of processes that they must follow. This concludes our mini session about the IaUW Navigator grant. Hope it was helpful, and we welcome you to any of our other mini webinars in this series. Thank you for joining.